My name's Emily Rush. I am the mother of 4 children. We live in Loganville, Georgia. I married my husband when I was 20, and we conceived our first child when I was 21 in 2013. I fell pregnant really quickly, and we were super excited. We found out we were having a daughter. We were both in college at the time and also working, so it was really a busy season for us, but the pregnancy was going perfectly smoothly. It wasn't until around, I was 37 weeks and 4 days when I started to feel some itchiness. At first I thought that maybe I had eaten something unusual. I don't have really any allergies, but I couldn't really figure anything else would be causing it. And it wasn't just my belly, it was my hands, it was the back of my knees, it was my arms, it was my face. So I endured one night of that, and the most difficult part was sleeping, because anytime the sheets in my bed would just barely touch my skin, it would cause me to have like an itching frenzy, and I just couldn't get comfortable. And so the next morning, I posted on social media, on my Facebook, and said, I'm itchy, and does anyone know why? It's not just my belly, but it's my hands, it's the back of my knees, it's my face, it's everywhere. And most people said that it was probably just my skin stretching from pregnancy, but one friend named Serenity commented that it could be a really serious liver problem and I should call my doctor today. They told me to come into the office that day, which was a Thursday. I went in, and she had not made any notes about my itchiness from the phone call I had made. They were more concerned that I might have had preeclampsia because of the swelling that I had mentioned. I wasn't worried at all about the swelling. I had had that for many weeks, and the doctors or my midwives were aware of it. It was a practice where you had a doctor, but they defaulted to the midwives unless there was something serious going on. And so I pushed the midwife about my itching and brought up what I had researched called cholestasis. I couldn't even pronounce it correctly at the time. I didn't know anything about it other than it was related to itching, and the worst thing I could tell that would happen would be a stillbirth. And I pushed for her to do lab work on to diagnose the cholestasis, if that might have been what I had. Immediately after the appointment, I went to do that lab work, and I happened to ask the lab tech how long the lab work would take to come back. And she said that the bile acid labs would take a few days, and they actually had to send it out to Virginia. So I did that lab work Friday morning. I continued to itch significantly through the weekend. It was really quite miserable. Monday morning came around, and the first thing I did when I woke up was check my email, and I saw that the lab work was in, and this was a message from the lab. The test value for normal for bile acids was 0 to 19, and mine was 141. So I knew that I had cholestasis, but I didn't know what to do. And immediately I called my doctor's office. The phone lines were really clogged, and it took me about 4 hours before I could speak with the on-call doctor. I was on hold for a significant amount of time. I continued to be on hold when I drove to work that morning. I was a nanny at the time, and so it was around lunchtime that I finally talked to someone, and they told me that I should come in about an hour when the on-call doctor could meet me at the office and do an NST and a biophysical profile. And the doctor came in to me and said they had made a call to the high-risk doctor, and he had determined that we should induce. And they were so excited. I was still kind of anticipating that the baby wouldn't be born for another couple of weeks, but I was 38 weeks and 1 day at that point, and they said that she could be born. And I arrived at the hospital, and it took about an hour for them to prepare the room that I needed. And once I got back, they started me on Cervidil. They wanted to wait to start Pitocin until the morning. And so we had a normal night at the hospital. I had some contractions, but nothing that I couldn't talk through. I could tell my belly was tightening. In the morning, they said they were going to remove the Cervidil after I took a shower and started Pitocin. And that was actually in my midwife's notes, that I needed to take a shower before they started Pitocin. I had taken a shower the night before. It wasn't that important to me, but I did so anyway, just being a new mom and just trying to do everything right for them. But when I got back from taking a shower, I had been off the monitors for about an hour. Not that I had taken a shower that long, but that's just when the nurses are making rounds on other patients, they can't get right to you. And so when she put the monitors back in my belly, they had a hard time finding Addison's heart rate. She did a call for all available staff to come, and quickly our room was flooded with many nurses and doctors. And so they were actually trying to use a Doppler to check her heart rate, and they pulled in an ultrasound machine to visualize her heart, and they confirmed that she did have a heartbeat, but it was really, really slow and low. And they said, we've got to get the baby out now. And so they unlocked the wheels of my bed, and we went running down the hall, me in my bed, and doors flying open. It was something you would see out of the movies. And my husband was left in the labor and delivery room. He didn't get to attend the C-section with me. I was crying and hyperventilating. They continued to have an oxygen mask on me, and I remember someone stood over my head and she said, "Miss Rush, I need you to do your very best to calm down." And so I tried, and then I was out. What I was told later was that when Addison was born, she did not have a heartbeat, and it took 5 or 6 minutes to resuscitate her. When I started to wake up from the C-section, my husband had said that she was in critical condition. What that meant to me was that maybe she'd be in the NICU for a few months, and then we'd bring home our perfectly healthy baby, because that was the only reference I had ever heard of when a baby needed to go to the NICU. It just took them a little longer. It didn't register to me that Addison was full term. She didn't need more time to mature. She'd been injured without the oxygen she desperately needed. My husband insisted that they bring my hospital bed to the NICU to see her, because they were concerned that he was concerned that I may not get to see her before she passed. They told me I couldn't rub her when I touched her because it may cause a seizure, and so I just very gently put my hand on her knee. Addison lived for 3 days on full life support. We were told that the EEG they did the day that she was born had no brain activity. We chose to take her off life support. She lived for about 15 minutes in my arms, and she died at 6:25 on March 14th, 2014. Her birthday was March 11th. We were told to wait a year to try to conceive again. And when we were preparing to try and conceive our second child, I decided to have a pre-pregnancy appointment with the high-risk doctor. I had never met him before, but he had signed off on the need for us to deliver. I told him that my midwives didn't think that cholestasis had anything to do with Addison's death, and he said, I don't know why they can say that. It absolutely had something to do with her death. The Christmas after she died, I couldn't rest, and I started researching studies about cholestasis and trying to understand why he was so certain that cholestasis had caused her death when the others didn't think so. I ended up seeking out an attorney, and while they did discover that the diagnosis of cholestasis was within reason, there were some missed fetal decelerations that Addison had before they told me to take a shower. And so they should have changed the protocol. I should never have gotten off the monitors to take a shower. And if the nurses and midwives had followed the guidelines to manage a high-risk patient, then Addison could have been here. We were fortunate that with our second child, we never developed cholestasis. And with our third child, we never developed cholestasis. My fourth child did develop cholestasis, or I did while I was pregnant with him. I was 36 weeks when I felt the itching with Emmett. The nurse practitioner immediately put me on ursodiol, which I had never been given or even suggested with my pregnancy with Addison. And she also ran labs for the bile acids, the ALT, the AST. Those labs took a full week or 5 days to come back, and we didn't get them back until the morning of the scheduled C-section. Perhaps we could have done the C-section a little sooner, but Emmett was born unaffected by the cholestasis. What I wish I had known about cholestasis before was that not all doctors know how to treat cholestasis, and asking your doctor their experience level and what the risks were by being overly cautious versus doing nothing would have been. At the time, I wasn't aware of ICP Care as a nonprofit, but I think their research and their advocacy for patients is doing great things, and I hope that in the future, the urgency for the lab work to diagnose cholestasis can be sped up, and that more doctors can be aware so that they can take this condition as serious as it is.